Members, it's the appointed time, and so I call to order the meeting now. The administration is joining us. I'll introduce the team. Miss Elaine Mack, Deputy Secretary for Health. Mr. Ronald Zhang, Principal Assistant Secretary for Health. Mr. Herman Law, Assistant Secretary for Health. Dr. Kitty Hui, Department of Health. Dr. Brian Ko, Department of Health. Mr. Ron Lee Cho, Principal Dental Officer, Department of Health. Dr. Andrew Chan, Senior at Department of Health. Also, this meeting is to receive deputations from members of the public on the Dentist Registration Amendment Bill 2024. There are 33 deputation representatives and individuals attending the meeting. The Secretariat has received 22 submissions. The administration has also provided an information note on the arrangement for internship and period of assessment. That's paper number CB bracket 4583/2024 bracket 02. I will invite the deputations and individuals to speak in a moment, and then I will ask the administration to give a overall response to the views expressed. Please limit your reply to 5 minutes, Deputy Secretary, so then members will have time to put questions to the members of the public attending the meeting today. Members may also put questions to the deputations and individuals. I'll see how much time is left and how many members wish to speak, and then I'll decide on the time allowed. The administration will give a written reply to the submissions and oral representations of deputations later. First, I would like to welcome all of you to the meeting. If I may remind you that you have 3 minutes to speak, and if the bell is rung, please stop speaking. Please be concise, and please do not use mixed code in your representation. The representations and submissions of the public are not protected by the Legislative Council Powers and Privileges Ordinance. And please note the security measures under the notes for members of the public attending meetings in conference rooms or observing meetings in public galleries in the Legislative Council complex. First, Dr. Otis Lam. Good morning. The Hong Kong Dental Association has 2 points to make primarily. That is for dentists with limited registration or special registration. After they've worked in the government for 5 years, they have to take the clinic. We want them to take the clinical exam because we need to check whether dentists are able to draw up treatment plans and so on. So we must not overlook the importance of such quality. So we won't allow any exemption there. And the second suggestion is, apart from taking Part 3 clinical examination, for dentists with limited registration, we would suggest that they also take the Part 1 written exam, because we want dentists to learn more about the professional code in Hong Kong and so on. That's all from us, really. Thank you. Next, Mr. Kwok Yui Chit. Thank you, Chairman. Good morning. I'm a 5th-year student of the Hong Kong University on dentistry. I will be graduating in 2025. First, I would like to thank the Bills Committee for holding this public hearing so dentist students have a chance to speak up. Now, after we learned that there will be this public hearing, we have collected views from students from different years, and we've prepared a submission. We submitted it a week ago, sorry. Now, but the submissions is not enough to cover all our views. That's why 17 students are here today to give our views to you. Now, the Hong Kong Dental Council, Hong Kong Dental Association, and other stakeholders have contributed much to upholding the professionalism of the dentist profession. Believe the bill will help to enhance the quality of dentists. We are aware of the proposals of on clinical experience. We're not trying to overturn the entire bill. We're just asking for a chance to express our views so that there will be an internship arrangement or that is fair and that students will accept. Now, some say that we only do practice on phantom heads, but I would like to explain further what our practical experience and clinical experience is, and also would like to clarify on the point about the pressing need for internship arrangements starting from 2025. And then there are also views that often compare the dentistry practice with the medical practice. And then there's the view that the dentist should follow the practice of doctors. But actually, our practice is very much different. And so we shouldn't really, it's not really a like-to-like comparison. And then the bill also suggests that there is an urgent need for dentist students to have internship arrangement. This causes concern to the public on the quality of graduates. So we'd like to clarify on that. And then in 2025, if we implement the internship arrangement, is against the principle of informed consent, because when we enroll into the program, we did not know at the time that there would be this one-year internship. And so those are the 5 points. And the 6th point is now there must be enough room for discussion before the passage of the bill. Now we're going to explain in detail the various issues. Now the bill has a far-reaching impact on students, so I hope you will consider those points carefully and take on board our views. Thank you. Next, Dr. Nelson Wong. Thank you. I'd like to make 3 points. One, for dentist graduates of the Hong Kong University, after completing a 6-year program, there will be an additional 1 year of internship. The proposal is good for the profession and the public, because that means there will be more experience gained by graduates. And then for students already enrolled in the program, it may not be fair to them, because their expectation is that they will be able to obtain the license immediately after graduation. Now, if I recall correctly, Commonwealth graduates in the past would have their qualification recognized, and there's exemption of the licentiate exam. But then eventually the government revoked that policy. Now for dentist students, they usually elite students. They do have the option to choose other professions. For example, taking up medical education. So for dentists, like other professionals, once they choose a profession, it will be the lifelong profession. Very few will switch to different professions halfway. So the government should have regard to the expectation of students already enrolled into the program, so they won't be affected by the bill. And as for dental therapists, in terms of the registration system, we must ensure that in the public sector there is a sufficient supply of such dental therapists, because this is a service that, again, has far-reaching impact on the oral health of the public. And third point, in terms of manpower supply, it's expected that there will still be a shortage of dentists by 2035. I believe you have not taken into account the supply of dental service on the mainland. Now, there is flooding of advertisements on mainland dental services in Hong Kong. So many people go to the mainland to receive dental treatment. This was not foreseen in the before, and that substantially reduced the demand for dental service in Hong Kong. So the government needs to review the situation. It must make sure that Hong Kong won't become the next Japan and so on, or Taiwan, or even the Saudi Arabia, where there's an oversupply of dentists. Thank you. Ms. Chen Wai Lam, I'm a fifth-year student, a dentist student. Now, the bill proposes an internship arrangement. I represent other dentist students, and I want to express support for this internship arrangement. Now there are 4 years of practical classes in the dentist program, and students take pride in the fact that they have much practical and clinical experiences in the program. And we need to make sure that students are qualified before they could graduate. But then the bills, in the context of the bill, the government says that there's a pressing need for internship arrangement, and we think we should rethink that. Now, students have to start treating patients from year 3 all the way to year 6 at the Prince Philip Dental Hospital. And each week there are over 20 hours of clinical sessions treating patients. And then we need to formulate treatment plans, and then we have to carry out the treatment, and then follow-up consultations are also taken up by the relevant dental students. And then there will be supervision by registered dentists, and then the treatment plans must be approved by the supervising dentists. And then from year 3 to year 6, the supervising dentists will try not to interfere with the work of the dental students to make sure they will gain useful experience. Now, there are different specialist discipline in the practice of dentistry, such as endodontics, periodontics, and so on. So that's why in the program there is good extent of clinical practice. We don't just practice on phantom heads. And then in the 6th year of dental program, there are certain requirements on the number of patients we need to treat, the number of treatment sessions, and so on. But perhaps the public do not know that. That's why dental students would like to share with you our work or our study, so that you know exactly what training we go through. Thank you. Next, Mr. Benjamin Xu. Thank you. I'm a year 5 student of the dentistry program of the Hong Kong U. Now, we have a close cooperation with the Dental Council to assess the content of the program. And after the latest assessments, there are recommendations to improve the program. Now, before dental students graduate, they must complete a certain number of treatment sessions for a certain number of patients before they could graduate. So there should be at least 50 patients each dentist student treat. And then there are different levels of complexity from 1 to 4. The first one is scaling or simple filling, and the next, the level 2 is specialist treatment such as root canal treatment, periodontal treatment, complex filling. But then there's level 3. Apart from cross-specialist treatment, there is need for bridges or crown. And level 4, maybe there's a need for level movable denture, and level 5 that involves a surgery extraction. So The dental students have to do treatment for all 5 levels. They have to also treat a certain number of patients in relation to all the treatments I mentioned just now. That includes root canal treatment, surgery, extraction, including wisdom tooth, and so on. So there are at least 47 items of treatment. Then students also have to practice at to provide emergency service, and then there are also starting from the 2020. We also need to, starting from some years ago, we have to start providing reports that cover details about treatment planning, execution, follow-up visits, and so on. This is to evaluate the students' clinical proficiency. So we can see that for the current dental students, they have to meet the latest adjusted requirements before they could graduate. So this is to make sure that they possess the professional knowledge, skills, and attitudes to meet the demands of dental practice and ensure patient safety. Next, Mr. Alex Chen.
I am a Year 5 student of the University of Hong Kong's dental program. HKU's dental program is currently ranked 3rd highest in the world, and of the top programs around the world, it is already one of the longest in duration. So let's compare ours with other renowned schools overseas. Let's take the University of Zurich, for example. It is the 8th ranked QS World University ranking for dentistry and has a 5-year program that does not require dental students to complete a specified number of treatment procedures or patient cases, nor does it mandate post-graduation internships. Similarly, at the Karolinska Institute in Sweden, which is ranked 7th in the world, they only require dental students to complete fewer than half the number of treatment procedures compared to HKU's program. Graduates from the Karolinska Institute also do not need to go through mandatory internships before obtaining their licenses. In the Asia-Pacific region, the Tokyo Medical and Dental University, which is ranked 4th in the world and 2nd in Asia after HKU, only offers a clinical internship period of 1 year and 6 months within their 6-year program. Data show that the dental faculty of HKU surpasses all these aforementioned schools in terms of the provision of clinical experiences for its students. In fact, by being so highly ranked in the QS University rankings, this is indicative of all our all-rounded curriculum that we all study in both clinical and scientific research skills, led by our highly acclaimed faculty staff. Therefore, it is invalid to claim that graduates from HKU dentistry lack clinical experience, and on this basis, should not impose an additional year of internship and period of assessment so urgently.
下一位馬浩之小姐。
多謝主席。
Next, Miss Jillian Ma. Thank you. I'm a 5th-year student of the Hong Kong U Dentistry program. Now, every week we need to provide dental emergency service for 2 to 3 hours. These are the outpatients, clinic patients. So we have to do patient selection. We also have to provide emergency treatment. And then students have to provide outpatient clinic service for doing preliminary diagnosis. And then we have to talk to the duty dentist as to whether the patient should become a patient of the teaching hospital. And then we have to consider the level of complexities of the treatment required. And then we refer the cases to reference students for follow-up. Now, if there is acute pain or a tooth is loose and so on, students actually have to provide emergency treatment, such as immediate extraction or pain treatment and pain relief or adjusting the crown and so on. And then students need to communicate with patients to explain to them their condition and also provide emergency treatment. Now, same as other integrated treatment, we cover different diseases at emergency department. there are patients who may have had cancers or stroke, and then students have to deal with that. And then if patients have different medical history, under the supervision of a registered dentist, students have to provide emergency services. So we can see, therefore, in a 6-year program, we do have experience in handling complicated cases with certain medical history. So we have to plan all the treatments for students, and then we also have the chance to see different patients with different cases. And then we have to then decide where to send the patients in terms of the different disciplines. So it's like a real working environment. Students are trained to provide emergency treatment and also to make independent assessment of patients. Now, the Dental Council and the Hong Kong U Faculty of Dentistry have a close cooperation to keep improving the content of the program. This is to ensure that students have all-round training so that we become qualified dentists when we graduate. Now, our supervising dentists will also fill in daily logs on the performance of students. So you can see that Hong Kong U students do have a certain degree of the clinical experience when they graduate. There's no urgency for the internship arrangement. Thank you.
想回應一下呢，有意見認為現時嘅
Next, Mr. Malcolm Mann, Aris. Thank you, Chairman. It is said that dental students don't have to follow up on the patients upon consultation. As an intern, I have to clarify that the Prince Philip Dental Hospital is a teaching hospital. The patients have been screened before they will be treated in our hospital. But screening is not to avoid any complex cases. It's just that these patients have special conditions. That is why they are worth studying on. After the dental students have taken on the case, they have to consult the patients, they have to take x-rays for them, and do oral examination. After collecting the information, they have to give out a preliminary diagnosis, and they have to talk to the dentist, and the plan will have to be passed by the dentist before the treatment can be implemented. There are 3 types of treatments. First, emergency cases and preventative dental care, including oral health examination, and then we will see if there is need to implement root canal therapy, and then we will see if the patients can take care of themselves before we will proceed with the treatment. From teaching the patients to brush their teeth to veneers and crowning, the dental students provide such services under the supervision of a dentist. After each treatment, the dentist will have to sign off. Even with simple cases, the dentist would ask the students how risky is the treatment, and because of this, we can see that even for simple cases, we need to look at the medical history of the patients, and we also have to look at how well aware of dental health they are and their dietary habits. For 5th year and 6th year students, the dentists are very confident in the students. For scaling and root canal therapy, the supervisors will not be interfering in the work of the dentist, and they encourage the students to complete this work on their own. I hope that what I said would instill confidence in the members of the public and LegCo members so that you can have your concern alleviated. And I hope that the members of the public would have confidence in the students and teachers of the Prince Philip Hospital. Thank you. Next, Ms. Rowena Yu. Thank you, Chairman. I'm Year 5 student. As mentioned by other deputations, we recognize the importance of the internship, but we wonder why there is an urgent need for mandatory internships. For the past graduates of the Faculty of Dentistry of Hong Kong, they provide safe services. And now, if you say that there is an urgent need for a mandatory internship, will that affect the confidence of Hong Kong citizens in locally trained dentists? especially the graduates that will be leaving school this year. As mentioned, the Dental Council Hong Kong review the dental program provided by the faculty every 5 years. And the dental students have completed the graduation requirements on treatment items and patients' cases as imposed by the Dental Council. In order to implement the internship, there should be manpower requirements, and we think that there should be a transitional arrangement. And I think that the Dental Council should talk to dental students. They should organize face-to-face consultation sessions, for example. I think that Dental Department of Health and the Dental Council, after considering a series of factors, implement the internship arrangement for the good of Hong Kong and patients. But this actually affects dentistry students along with their parents, and this will pose burden on the specified institutions who would be taking on interns. I hope that before implementing the internship arrangement, there should be a transitional arrangement. I wonder why there is such an urgent need suddenly. Actually, the Faculty of Dentistry Hong Kong U actually also already reviewed the dental program upon the recent accreditation given by the Dental Council of Hong Kong. Should we not delay the implementation of the internship arrangement to graduates of 2030? Next, Dr. Lee Kin Man. Thank you. The Dental Council Hong Kong supports the bills, the Dentist Registration Amendment Bill 2024. Regarding the internship arrangements and the views of the students, we have some points to make. Since 2021, the Dental Council regularly reviews the dental program provided by the Faculty of Dentistry of Hong Kong U every 5 years, and we proposes recommendations to the relevant program. The Dental Council proposed multiple times that clinical experience of dental students needs to be enhanced. The Dental Council all along maintains close liaison with the relevant faculty. Dental technology evolves rapidly, and we have aging patients, and there is a higher demand for patients, higher demand from patients with special needs. We need to build the students' foundation, and we have to screen some of the patients for the students to practice on. That is why we think that we have to do skill matching for interns, and there is an urgent need to implement a mandatory internship and assessment, because internship will give students a real-life environment for practice. For local patients with different conditions, they can treat them in order to enhance their experience, and that they can work with local dental care professionals. This will enhance their clinical experience. I hope that members of the public, including dental graduates, would think that this amendment bill is an opportunity instead of a burden. And I think that they should put patients' safety and repetition of the profession first. Dental graduates enroll in the program in order to serve the patients. Dental care professionals should be able to serve the members of the public, and I think that we have to strike a balance here so that members of the public will have confidence in the dental care profession in Hong Kong. Thank you. Next, Mr. Chan Clock-in. Thank you, Chairman. I'm a Year 3 student. The government and stakeholders repeatedly compare dental and medical programs, emphasizing that dental graduates should follow the housemanship requirements for medical students. But the two medical schools in Hong Kong, there is a difference between dental and medical programs. Take CUHK as an example. For the first and second year, we have to go through knowledge-based studying, and then for the fourth year, it involves bedside teaching, medical history taking, physical examinations. We have to work with senior dentists, and we should work on treatment plan and surgical observation together. For medical students, they don't really have clinical exposure, and that is why they should have to go through a housemanship. But for dental professionals, we emphasize dexterity, aesthetic, and comprehensive dental care. Therefore, in addition to basic knowledge education, clinical practice is a major component of the dental program. But actually, during the study in the dentistry program, we are already exposed to such experience. From year 3 to year 6, we have our skills trained and we have accumulated relevant experience. So that's different from the medical program. The clinical aspects of the dentistry students is more substantial, so we should not compare the two programs. Thank you. Next, Ms. Lam Ching Hei. Thank you. I'm a year 3 student of the Faculty of Dentistry of the Hong Kong U. Writing on what other students have said, it seems that medical students and dentists are both in the healthcare sector. It's perhaps fair to make an apple-to-apple comparison, but that's not fair. Let me take medical students of Chinese University of Hong Kong as an example. It is stated very clearly on the medical school website that internship is a requirement for students to migrate to full registration. So incoming students know very well before enrollment that they have to fulfill an internship requirement at the year 7 of their study. So when they enroll in the program, they have this informed consent that they should go through an internship year. But for class of 2029, we were not aware of such an arrangement. The government is trying to implement the internship arrangement next year, but the details are still in the drafting stage. We don't know where we will be interning at, along with other details. It seems that our informed consent has been stripped off from us. And this amendment bill will harm the image of Faculty of Dentistry, Hong Kong U. The members of the public used to be very confident in the graduates of Faculty of Dentistry of Hong Kong U. We rank top 3 in the world. But as the amendment bill is rolled out, there are some people who start to question the capability of the dentistry students. They questioned why the dentistry students did not have to go through internship. Did they just work on phantom heads during the years of studies? This seems to be a misunderstanding on the dentistry students, and this actually diminished the confidence of us. As mentioned, since year 3, we have to practice on actual patients. So we don't really understand that there's such an urgent need for mandatory internship. And it seems that there is an impression that without going through an internship, we're not qualified. And this actually ignores the clinical exposure that year 3 to year 6 students were exposed to. Next, Mr. Kong Leong Han. I'm year 3 of the Faculty of Dentistry, Hong Kong U. I just took an examination a few days ago. And I think that I have the responsibility to express my views. Very few people would speak up for us. Regular members of the public don't feel a difference. for the mandatory internship arrangement. They may think that because of the low quality of the graduates of the Faculty of Dentistry Hong Kong U, we have to implement the internship arrangement. How will people think of the graduates? As dental technology advances very quickly, dentists have to fulfill a certain hours of continuing education. And I think that the government have to clarify very clearly why there is a sudden urgent need for mandatory internship. As mentioned in our submissions, we only have 20 disciplinary actions taken against dentists, and only 3 involve graduates after 2010. For disciplinary cases against dentists, there is 0 for graduates of the class 2015. We don't really have much healthcare crisis in relation to dentistry, and I would like to thank the 8 deputations that have submitted submissions despite not being here at the hearing. I would like to quote from a parent who said that they spent their lifelong savings in order to have their son study dentistry so that the son, upon graduation, would help out the family financially. We all trusted Section 8, Bracket 1B of the Dentist Registration Ordinance that we will be granted a full license upon graduation. And I think that, therefore, the government should clarify why there is such an urgent need to mandate internship and assessments. For students and parents who believe in the Dentist Registration Ordinance, it seems that this amendment will go against their beliefs. As mentioned by President Xi, we should uphold the rule of law, fairness and justice, and we think that the laws should protect our next generation. Next, Mr. Ma Hoi. Thank you, Chairman. I'm a Year 2 student of Hong Kong U Faculty of Dentistry. In the 6 years of studies, well, now it's extended for another year because we have to go through an internship before we can be granted a license. We are surprised and taken aback by the arrangement. I know that there is certain significance to the arrangement, and a lot of students think that their rights to be informed has not been as respected. Government stresses time and again the purpose of the internship, but I think that we should be made aware of the requirements before we were enrolled. After we have been informed we're already a dentistry student, it leaves us no choice. And there is uncertainty in the internship arrangement. Without knowing the details, we would be worried. I'm sure that members of the public, LegCo members, and government officials would understand how we feel. We always want to make a decision while being informed. This arrangement of internship will affect our life planning, and this is more significant than any regular decisions that we make on a day-to-day basis. We should be made aware of this arrangement before we were enrolled. Some students said that if they knew they had to study for 7 years before they can be granted a license, their parents may ask them to study elsewhere. But maybe some students may continue to enroll in the program despite knowing that there will be 7 years of studies, but this is a great impact. Thank you. Next, Ms. Maggie Xiong. Thank you, Chairman. I'm a Year 2 student of the Faculty of Dentistry, Hong Kong U. As dental students, we have to learn about this concept of informed consent. This point's been raised by other students. I would like to supplement. for secondary schools graduates, before they enroll in the program, they would know about or learn about the duration, content, and employment prospects of the dental program before enrollment. The internship and assessment period after graduation are determining factors during the university application programs or process. The eligibility for licensing has its pros and cons, and I think that the students should be informed before they make a decision. But we were not informed of the internship arrangement before we enrolled in the program. Let me give you an example to illustrate what informed consent mean. In our day-to-day consultation and treatment, we have to explain the treatment plan to our patients, the risk, the pros and cons. Only after obtaining informed consent can we start the treatment plan. We cannot just say that the treatment is for the good of the patients to implement it without the informed consent of the patients. If we apply the same theory to internship, before enrollment, we did not know about this internship arrangement. So I think that we should have the right to be informed, and I hope that the internship arrangement will only be implemented starting from the graduates of 2030, and we have to explain to potential students about the internship arrangement. Thank you.
下一位司
Next, Ms. Z. Kit Ying. Thank you, Chairperson. Members, dentists, good morning. I'm a fifth-year student of the Faculty of Dentistry. Quite many students said that the internship arrangements do have their purposes, but that's not fair to us. Before admission, we try very hard to have an understanding of the contents of different programs. The Faculty of Dentistry told us clinical experience would be involved in the program. We would be able to get in touch with patients very early. This has bothered a lot of students. There's a great difference between the information they had before admission and that they have now. We had informed consent when we chose the Faculty of Dentistry. We think that the University of Hong Kong has its advantages. That's exactly why we chose this program. We had informed consent. We had the right to know. Internship arrangements do have their purposes and pros, but we don't have any choices. This is the reality that we have to face. When we knew of the internship arrangements, we had already been enrolled in the program. We are about to graduate. In the program, students said there are new graduation requirements. We need to submit further reports, meet more patients, draw up more treatment plans. We are willing to accept this. We are willing to comply with the requirements of the Dental Council of Hong Kong. We are willing to accept these changes. But shortly before graduation, we are told that we need to have one more year of internship after graduation. This has much of an impact on us. If you put yourselves into our shoes, you will understand that this has an important impact on us. This measure does not only affect one or two students. It affects a total of 400 dentistry students as well as their life planning. Students' background expectations vary. So before admission, students did have detailed planning and consideration. Some families have financial difficulties. Some would like to undergo specialist training after graduation. Some would like to practice overseas. These arrangements catch them off guard. They have no room for further consideration. So I hope our rights and expectations, right to know and right to choose, will be respected. So therefore, the dentists that are going to, this arrangement should be implemented for the cohort after 2030. Thank you. Next, Mrs. Wong Wing-zi. Thank you, Chairperson. On local training and limited registration dentists, we have no doubts about their expertise and knowledge. They do have the ability to practice. There's a huge demand for public dental services. The administration is going to effect changes in the local system. So I'd like the administration to announce the details about the internship as early as possible. So these prospective dentists will understand their requirements as well as the arrangements that they will have to face. Thank you. Next, Dr. Ju Wing-ho. Thank you, Chairman. First of all, I support the Dentists Registration Amendment Bill 2024. There's a lack of manpower for dental services in Hong Kong. In media reports, there's an imbalance of public dental services, so few work in the primary dental health care. We also need to enhance the supervision of ancillary dental workers. They can help provide preventive treatment. I have a question on the introduction of non-locally trained dentists. I support this in general. But do they have to pass examinations afterwards? On specialist dentists. For specialist dentists in Hong Kong, there's a difference between the specialist system in Hong Kong and that overseas. So for them to transition from overseas specialists to Hong Kong specialists, how will their specialism be recognized? I'd like to know more about this. Next, Dr. Andrew Butt. Thank you, Chairman. In the amendment bill, dental graduates need to undergo 1 year of internship. It also targets non-locally trained dentists. Likewise, they have to undergo 1 year of period of assessment. They need to pass it before they can migrate to full registration dentists. During this assessment period, their remuneration is exactly the same as in the dental graduates in the 1 year of internship arrangements. Before non-locally trained dentists come to Hong Kong, they already have a couple of practice experience. Some non-locally trained dentists even have specialist qualifications. So I suggest the administration should shorten the period of assessment case by case. There should also be adjustments to remunerations to non-locally trained dentists in order to attract more non-locally trained dentists to come to Hong Kong for practice. Next, Mr. Ki Yong. Good morning. Thank you. I'd like to ask about limited registration. Dentists already have the relevant qualifications to work as a dentist, but they are new to Hong Kong and they are not familiar with the environment in Hong Kong. Do they need to declare their no conviction record? We need to enhance their understanding of the dental care situation in Hong Kong. In Hong Kong, we all want to troll for talent. When non-locally trained dentists come to Hong Kong to work as limited registration dentists, can we consider improving their remuneration? Thank you. Next, Mr. Anthony Fong from Yan Oi Tong. I have no submissions. Thank you, Chairman. Next, Mr. Lok Kam Sheng from Hong Kong Dental Hygienists Association, Hong Kong DHA. Good morning. Good morning, Chairman, members, and dentists. I'm speaking on behalf of the Hong Kong DHA. I'm also speaking on behalf of the other two organizations. That is the DOH Dental Therapists and Dental Hygienists Association. All three organizations support the Dentists Registration Amendment Bill 2024. We agree to the changes to be made to dentists, dental therapists, as well as dental hygienists. We have the following comments in order to include these professionals into the lay persons. They have rich experience and clinical experience in dental care. They play an important role in the provision of dental care services that can provide professional insights and opinions. So including them as the lay member of the Dental Council of Hong Kong will be helpful in enhancing the representativeness and the professionalism of the council. The development of dental therapists and hygienists have direct impact. Their participation in the Dental Council of Hong Kong will also help draw up a more objective and comprehensive bill to provide better monitoring, supervision. So, based on the reasons above, I hope dental therapists and dental hygienists will be included as lay member of the Dental Council of Hong Kong. Thank you, Chairman. Next, Dr. Deborah Chen from the Loving Smiles Foundation Limited. Good morning, Chairman. Since the establishment, Loving Smiles Foundation Limited has been providing dental care services to groups of persons with special needs, especially for those that are more fragile or vulnerable. We welcome the recommendations made in the Dentists Registration Amendment Bill 2024. That is the introduction of non-locally trained dentists to come to Hong Kong as special registration dentists as well as limited registration dentists. This can provide Hong Kong with more dentists. On special registration dentists, if these specialist dentists come to Hong Kong for practice, as we don't have this specialism in Hong Kong yet, they can enhance our professionalism. They can also enhance our professional expertise, know-how, and experience. Another point I'd like to make is that we welcome the ancillary dental workers registration system. And that they can work in the private sector under the supervision of registered dentists. They work on preventive treatment and primary dental treatment. They are professional in this connection. So if they can provide services and play a part in this specialism in dental services, they can help enhance the overall level of dental services in Hong Kong. Thank you. Next, Dr. Billy Chiu from the Liberal Party. Thank you, Chairman. I support the Dentists Registration Amendment Bill 2024. We have been discussing this for a long time. There's a lack of manpower in public dental care services. The government has been working hard to provide more manpower. the number of places of dentistry has been increased 4 times. The quota used to be 90. There is still a lack of dentists owing to registration wave. According to our Audit Commission's report, for emergency dental care services and support for the old, in 5 years, from 43,220, the number of tickets has been reduced to some 20,000. We shouldn't waste any time in solving the problem about the shortage of dentists. Dentists need to have good hand-eye coordination. They need to have good dexterity. For example, for mentally handicapped, they need to be put under general anesthesia before they can receive dental care services. We also support ancillary dental workers to be registered to support their professional development so that there will be sufficient manpower resources to address the needs in Hong Kong. Apart from the 6 amendments, we also urge the administration to look into the possibility of public-private partnership, PPP. Drawing reference from the Western medicine arrangements, such as the CDCC pilot scheme, the progress is good. So I believe the public and private sectors will be interested in studying this direction. We can take a progressive approach. It also has good cost effectiveness. We can study a sustainable way forward in order to consider different opinions in the community. Public education is also important. We need to work on prevention through district health centers, DHC. We need to promote patient-oriented approach. I believe cross-disciplinary services will be helpful. Next, Mr. Kenny Lau from the Board of Governors to Prince Philip Dental Hospital. I support the bill. We support limited registration and special registration. We are specified institution as well. The Prince Philip Dental Hospital is a teaching hospital to train dental students. We can support the undergraduates of the Faculty of Dentistry. We can also enhance our support for ancillary dental workers. Prince Philip Dental Hospital is the only organization training dental therapists and dental hygienists. We support the registration system for them in order to turn them into dental care professionals. This can establish their professional standing so that members of the public will be more willing to accept their services. With the professional standing, we can attract more people who aspire to serve the Hong Kong public to join this industry. I've been a dentist in the private sector for more than 3 decades. I support the internship arrangements as well as the period of assessment. For non-locally trained dentists, when they come to Hong Kong for practice, they may have passed the licensing examinations, but after the internship arrangements, they will be in a better position to work in the local environment. Local graduates will also be able to accumulate a lot of clinical experience in a short period of time. For example, emergency dental care services, as well as special dental services in the community. For example, elderly outreach or services targeting the old and the mentally handicapped, as well as services for children, and specialist services in hospitals. This is limited in undergraduate programs. Next, Mr. Tim Pang, Society for Community Organization.
Mr. Tim Peng of SOCO. Yeah. As you can see, there is a shortage of dentists in Hong Kong, and that has much impact on dental services in Hong Kong, in particular public services, and also for NGOs that provide cheap dental service. They also affected because there is a shortage of manpower, and they're not able to offer attractive pay to for dentists to join them. And so that affects the service provided to the public and the elderly. And then the long queues outside the government clinics will say a lot about that. Now, the bill will help to provide more manpower to the dental profession, and we support that. As for dental students, they all agree there's a need for internship, but then it's a question of informed consent. Therefore, they want the internship arrangement to start only from 2030. Now, I've actually received complaints from many patients about informed consent. That is, dentists performing extra procedures. But of course, in the course of the surgery, it's hard for the dentist doctors to seek informed consent from patients in order to address an emergency. So I hope the students will appreciate this point too. Now, if there are any changes or special circumstances in the community and there's a need to adjust the program arrangement to meet the needs of the community, it's a reasonable practice. If we want the grassroots sector wait another 6 years before they receive adequate service, really does not make sense. So I hope the students will consider the needs of patients and bear in mind they join the profession to serve the public. Now, we need to troll for talents, so that's why with the admission of non-locally talents, so non-locally trained dentists, there should be more deregulation. We shouldn't ask for already there's a assessment of 5 years clinical experience, so is there still a need for an examination? Because the 5 years of clinical practice would be more than enough to demonstrate the skills and performance of the dentist concerned. So, and then they should be allowed to work more independently. Ms. Kwong Chak Chi. I'm also a student from the Hong Kong U Faculty of Dentistry. Now, there's still not enough arrangement for the internship requirements in terms of supporting facilities and human services and human resources. So hastily implementing the requirements may not achieve the intended purpose of enriching clinical experience, and it won't be beneficial to all parties. Now, for each cohort, we have some 70 to 100 dental students, and the number of dental graduates expected to increase continuously. So there are not enough supporting facilities. Now, with the internship requirements, that means there will be 70 to 100 interns in the Department of Health. That means there's a need for more ancillary dental professionals to support the work of the interns. So then there's no mention as to how this could be made possible. So before we know exactly what the arrangements are for the internship, before we know if the government is able to give enough supporting staff for the 100 or so interns each year, then we do not know if the arrangement will be better than the existing clinical practice arrangement during the program. And then on the internship arrangement, the ultimate purpose is to provide more clinical experience to the dental students, but we doubt if it's possible without this necessary support and so on. Next, Mr. Tam Chan Chung phone. Well, we are from the Project Concern Hong Kong. We are a non-profit making charitable body. We provide mobile dental services to the elderly and those with special dental needs and the low-income groups. Now, our board had a discussion at a meeting on the 23rd of April this year, and we support the Dentist Registration Amendment Bill 2024. But then we would like the government to further clarify the employment arrangements for non-locally trained dentists, the insurance arrangement, and means to ensure the professional standards of these dentists and so on. Next, Mr. Kong Chi-o. Thank you. I'm year 1 student of the dentistry program of the Hong Kong University. Now, there is a serious shortage of dentists and there are vacancies in the government. So there are not enough registered dentists to supervise the work of interns. And then for the 1-year internship arrangements, you don't know what the arrangements will be yet. And in fact, for the exam standards and so on, for medical officers, medical interns, the information is available online, so students can check the information. For example, for Hong Kong U medical students, all the requirements are online, and so students know that they need to complete the logbooks and so on. And that their logbook is very similar to our dentist logbook. It's also for the purpose of assessment. And after we complete each clinical session, the clinical supervisors will have to give us a score, and then the log has to be signed. And then we are required to provide treatment independently. And supervising dentists try not to intervene in the treatment. Now, if our performance is satisfactory, say with doing the crown and so on, the dentist, the supervising officer will ask us to redo the work. And if our performance is not satisfactory, the faculty will ask us to repeat the program for a year. So we can see, therefore, our logbook is very similar to that for medical students. Now, in the internship arrangement, if there's going to be internship for us, then we are just repeating the same logbook. It doesn't make sense. Ms. N.G. Kong, I'm a year 1 student of the Faculty of Dentistry of the Hong Kong U. Now, we do not yet know what the criteria for the internship arrangements, internship requirements are. And so we do not know what the assessment content will be, and that will seriously affect the 400 dental students in terms of their career planning. Now, when I enrolled for the dentistry program, I did not know that there would be a 1-year internship. And we do not know yet what the assessment content will be. And so there's uncertainty for us. And then for graduates who want to go into specialist field and who may want to study overseas, they do not know about this internship arrangement. It will add to the uncertainties of their career planning. And then there's a delay in the awarding of the license, and certainly that will affect the public who need a specialist service in future. Mr. Lam Pui Sung. I'm a year 5 student of the Hong Kong U in dentistry. Now, we are current dental students, and just now we all gave our views on the based on our program content and so on. Now, of course, we need to have good communication skills with the patients, and we need to be able to draw up treatment plans and so on. But for the proposal to include a 1-year internship, we believe it should only be implemented from 2030, where there is the first cohort of students after the bill is passed. Now, the 1-year internship will help to enrich clinical experience, but then now there are limited channels for us to give our views on the arrangements for the internship. Now, there are different stakeholders, the Department of Health, the Dental Council, and the Prince Philip Dental Hospital have formed a working group to determine the internship arrangements. Now, I'm a student representative on the working group. But then the working group rarely had meetings in the past year to discuss the internship arrangement. I think most dental students are more than happy to contribute to fleshing out the internship arrangement. We've actually collected the views of dental students. We would like to convey those views to you, taking this opportunity. We would like a more specialist discipline to be included in the internship arrangement, such as orthodontics, dental implants, and so on. And so that there will be opportunities for continuous education. And then the internship arrangement should include more content than the current program for the benefit to be achieved. And then there should be transitional training for specialization, such as the position of training support dental officer, formerly known as junior hospital dental officer at the Prince Philip Dental Hospital. The job positions may take the place of internship requirements, and that will certainly be good incentive for more to enroll in the dentistry program. So we earnestly urge you to consider and adopt our suggestions. Thank you. Last, Mr. Mchakhan Loksin Tong. Now we provide primary dental care services to the grassroots sector. So we believe by introducing non-locally trained dentists and the provisional registration system that will help to provide more manpower. We hope the government will implement the policy as soon as possible, because this is about the oral health of the public, and there's need for us to provide such services to the disadvantaged. Now, we have a serious shortage of manpower, and the situation is particularly dire in the public sector. Now, there's a long wait for dental service, and so maybe that means the best opportunity for treatment is missed. And so then the condition will become more serious, so that will actually add further to our public sector burden. So the government needs to do more to implement the various policies and address the manpower shortage for the dental discipline. In the 2022 policy address, that's the proposal of the primary health care blueprint. And with oral health and dental care, the aim should be, the policy objective is early as prevention, early identification, and early treatment. But right now, we don't have enough manpower to achieve that. So now there's going to be a statutory registration system for dental hygienists and dental therapists. That means they will become more professional with better regulation, and that will help to provide better service to the public sector, non-profit making bodies, and so on. They will also share in the burden of dentists by taking up work such as scaling and so on. Now, if the dental dental care professionals can play a bigger role, then that will also help to promote the objective of more prevention and less treatment. So we hope the bill will become implemented as soon as possible. Deputy Secretary. Thank you. On behalf of the Health Bureau, I would like to thank all the deputations attending the meeting here today. And actually, as we prepared drew up the bill, they also many of them gave their views to us. We've actually met with the representatives of the teaching staff and students of the Faculty of Dentistry on a number of occasions. So I'd like to thank them for their time and contribution. Since last since February last year, we met with various stakeholders, dental council, dental professional bodies, and partners such as teaching staff and students of the Faculty of Dentistry, and then the relevant ancillary professional groups and so on. We've met with various parties to listen to their views, and the bill is a result of all this consultation sessions, and so we have had regard to the needs for dental services in Hong Kong, and it is a comprehensive review of the dental and oral care services that the government provides. And now first on the question of manpower, Dr. Wong talked about the demands for dental care professionals, and if would that be affected by the latest development? Actually, we do rolling 3-year projection of manpower needs, so we keep updating our projection, and we keep a close watch of developments in the sector. Dr. Chu suggested that as we bring in non-locally trained dentists, there should be more collaboration with locally trained dentists in the private sector. Well, for young people aged between 13 and 17, we're going to start a pilot scheme for dental care for them. So we plan to work with private dentists in that scheme. And we will be seeking more views so that we could work out the details of the pilot scheme. Now, for non-locally trained dentists, they have to sit a licensing exam to join the profession here. And then there are others who registered overseas, and they will also be able to come to Hong Kong. Now, on their employment arrangement, say in the Department's Health, their pay and condition service will be the same as local dentists. So that's a form of protection to these dentists from overseas. And then we have the proposed limited registration, special registration. We've heard different views on whether they should be asked to sit examination and what the arrangement and so on. We've heard the views of the Dental Association. For limited registration and special registration, as they transition to full registration, initially we proposed that there's no need to sit the licensing exam at all. But then we've heard, just because we've heard the views of different sectors, and then now to achieve a better balance, we now allow the Dental Council to decide whether the person involved should sit the clinical part of the licensing exam. So that's out because we've considered the views expressed. On transition to specialization, we've talked to the Prince Philip Dental Hospital. Now, on registration of non-locally trained dentists, and on the proposal of an internship arrangement. We have actually started discussion with relevant parties on how we could ensure there's proper transition to specialization. And then just now, a point is made for non-locally trained dentists coming to Hong Kong on limited registration, special registration. Yes, in the bill, we will state clearly there's need to do integrity check. This is to make sure there's good integrity of dentists concerned. On the provisional registration mechanism, that is local dental graduates have to go through 1 year of internship before they could become fully registered. Now, the Dental Council and the profession are of the views that there's need for graduates to gain more clinical experience so they learn about the practice in Hong Kong. This is to ensure patient safety. The measure is to boost the professional standards of the dentists. It has nothing to do with manpower shortage. And then the Department of Health will provide internship positions, and then for non-locally trained dentists will also be providing the period of assessment. Now, we've heard the views of dental students about the 1-year internship arrangement. Now, this applies to local dental students, and I'd like to make a number of points. First, introducing the internship arrangement for local dental students is not something new. It's not a new idea that's only come out in recent years, because the dental council is responsible for maintaining the professional standards of dentists. The Dental Council has vetted the dental program of the Hong Kong U on several occasions, and on various occasions they have suggested an internship arrangement for students to gain more clinical experience. And then in recent years, many different sectors, including the profession, have also asked for more clinical training for students. This is to ensure better quality. And in the first round of consultation on the bill, we made the explanation to the teaching staff and students of the Hong Kong U. And then a working group was set up, as some students mentioned. The Dental Council and the Department of Health are on the working group to thresh out the details for the internship arrangements. Now, students wanted to learn more about the assessment content, the criteria, and so on. And then current dental students are involved in this exercise. We'll continue to listen to the views of students.
佢哋同一啲
Internships and assessees of the assessment, they actually will be employed as a dentist and they will be paid. The salary is about $34,000. This salary level is comparable to medical interns. During the period of internship assessment is 12 months. Internship have to rotate different positions. Under the supervision of a senior registered dentist, and they have to serve at school dental care service, dental community special dental service, general dentistry, and hospital dental service units. For example, they have to conduct government dental outpatient services and serve patients with intellectual disabilities, and they also have to serve outpatient clinics of the government. We have taken on board students' views. Students may also be able to be employed at specialist units for them to have further exposure to different specialties. And that's been set out in the paper submitted to the LegCo yesterday. In last December, we have arranged a webinar and Zoom meeting with students via Hong Kong U. And this meeting was open to all dental students of Hong Kong U. And at the meeting, our representative explained in detail the content of the assessment and internship. This shows that internship allow assessees and interns to be able to be exposed to different types of patients in the local setting, and they can work together with other dental professionals. All this experience cannot be gained during the years of study of the students at Hong Kong U, because they will also be able to work under the supervision of an actual senior registered dentist. We will implement the arrangement as soon as possible, and that will be applicable to dentistry students of the class of 2025. Some students said that they are worried if we are ready to implement the arrangement. We can undertake that since last year. Actually, we have already started the relevant arrangement with graduates, and all the supporting measures are in place, so the students don't have to worry about that. The quality and the quantity of dentists are equally important, and we want to roll out measures to meet the demand and expectations of the general public. I hope that the members of the public and the stakeholders will support our bill, and we will continue to listen to views from the dental students and other stakeholders, and we hope that we can amend the bill as soon as possible to provide quality dental services to the members of the public. Now is the time for members to put questions. If you're interested to speak, please press the request to speak button at your seat. I will decide on the time that each member will be allowed to speak based on how many members will press the button. According to Rule 83A of the Rules of Procedure, if members have any direct or indirect pecuniary interest in relation to the items of discussion today, please disclose the nature of the interest before you speak. There are more than 7 members at the meeting today, but there are only 7 members who have pressed the button. This session will end at 10:30 a.m. 8 members, okay? Each member will have 3 minutes, including question and answer. If you would like to have our deputations answer the question, please name them as you put your question. I will read out the names of the members who press the button: Reverend Peter Kun, Ms. Chen Hua Yan, Dr. David Lam, Mr. Holden Chow, Mr. Lam Chen Sing, Ms. Lam So Wai, Professor Chen Wing Kwong, and Ms. Lilian Kwok. Reverend Peter Kun, please. Thank you, Chairman. Now we've heard from the dental students of Hong Kong U. We understand that they think that this internship arrangement is new. A lot of students think that it's okay to apply this internship arrangements to incoming students. But what we should discuss today is whether internship is beneficial to enhancing the standards of the dental professional. And we think that we should look at the benefits of the entire society instead of individual interests. I would like to ask the administration. The interns will be exposed to different sectors. As we all know, the demand for public dental care service is high, and people have been queuing outside the clinics for such service. If we have to delay the graduation of dental students, will that pose further burden on the public dental care service? I know that the government wants the students to be exposed to different cases and enhance their experience. Can we arrange the internship in such a manner? For example, as long as the graduates fulfill a certain hours of clinical work, they can migrate to full registration. I know that the government wants them to expose to different cases because when they practice in the private sector, they are not exposed to, for example, patients with special needs. Can we put in place a number of hours of clinical work instead of mandating a year of internship? Dr. Hui? Thank you, Chairman and Reverend Peter Kun. Good morning, students. As mentioned, interns would be graduates of dentistry program of Hong Kong U. They are provisional dentists. When the interns work at the specified institution, the Department of Health would be arranging these interns to work at different positions. Some ask if the Department of Health and the specified institutions have enough resources to make such an arrangement of internship. This is a policy change. We will try our very best to make sure that there is enough resources to implement such a policy. And outpatient dental care service will not be affected. We think that this internship arrangement will allow interns to work at a real-life settings, and they will be able to gain from such an experience. During the rotation, they will be able to work at the government clinics, and they also would be able to serve as community special dental care service and other institutions. They can learn what they cannot at school by rotating at various positions at these institutions and units. By serving the community, they will be able to benefit professionally. Thank you. Next, Ms. Chan Hua Yan. My apologies, Reverend Peter Kun, you only have 3 minutes to speak. This meeting will end at 10:30 a.m. I cannot hear what you speak. My question on examination has not been addressed. They will reply you in writing. You can continue to put this question in the next meeting. I don't think that you have to follow up on it here. You have exceeded the 3-minute limit, and I hope that the member would put their questions very succinctly, and you should allow time for the government to reply. Thank you. Ms. Chan Hua Yan. Thank you, deputations, for coming to give their views. I would first like to ask the questions to students. Do you think that you should enhance your professionalism and you're not against the internship arrangement, but you're against this idea of imposing an internship arrangement before after you're enrolled in the program? Let me ask Mr. Kwok. You're a Year 5 student. If we impose an internship arrangement during your summer holidays for you to work at different government departments, will you be willing to do that so that you don't have to go through a year of internship after graduation? You have some Year 2, Year 3 students here. Are you against this extra year of internship arrangement? I would also like to ask Dr. Chiu. Should the dentist in the private sector not work at government outpatient service units more? How can we get you back in the public sector? We have a 30% vacancy. I think that we should not just have students work as interns at the government. Also, I would like to ask the Dental Council, Dr. Lee, is an additional 1-year internship arrangement enough? Can the students make use of their summer holidays to work as interns so that they don't have to work a year of internship upon graduation? Please allow time for the deputations to answer the questions. They can reply in writing. I can put the question if they give me a reply in writing. You've taken up my time. Please give me an extra 15 seconds. Dr. Lee, is this the only option? Can the students only go through internship upon graduation? If you cannot finish your answer, please give me a reply in writing. Mr. Kwok, thank you for your question. There's no way for me to discuss with my fellow students on my answer, but for me personally, we have to fulfill a certain extra requirements imposed upon us by the Dental Council. Recently, if we have to have these internship during summer holidays instead of an extra year of internship after graduation, I think that we will all agree to it. Thank you. Next, Dr. David Lam. Thank you for coming to give your views. And the students have collectively given their views in a very civilized manner. I would like to thank them. I believe that the students are very clear in their stance. They are not against this internship arrangement to enhance their knowledge, and they question the urgency. The government all along said that there is an urgent need for mandatory internships and assessment, and without giving them any reason. What does urgent need mean? It means that if someone is hit by a car and they would die without any treatment, and if a patient have to clean their kidney and if you don't clean, they would die, this will constitute urgent need. The Dental Council has asked the Faculty of Dentistry to review their dental program regularly. The urgent need will only be justified if the dental students will kill someone if they don't go through the internship. I know that if there is any deficiency in the dental program, after practicing in the medical field for so many years, I still have some deficiency. If you think that the dental program of the Hong Kong U and the Prince Philip Dental Hospital is not comprehensive enough, can you not impose an internship during their summer holidays? Or perhaps you could ask the students intern at the Department of Health and the specified institutions during their years of study, just like what the medical students do. Do we really have to impose the internship requirements upon graduation of the students? If you do that, you would find that it's not necessary to have students intern after graduation. A lot of people think that the students work on phantom heads. So I would like to know how many percent of the clinical work is done on phantom heads and how many percent of dental work is done on actual patients. Who would take the question? Deputy Secretary? Thank you. Do you have any figures? Dr. Lam asked about the percentage. I'll ask Mr. Wano Chang to take the question. Thank you. For the Prince Philip Dental Hospital, they have given us some figure. Over the past few years during the COVID-19 pandemic, we were not able to take on certain cases. I don't have time for you to give detailed explanation. Do you have the percentage? Yes. Prior to COVID-19, just let us know about the percentage. Because I'm not able to calculate the percentage. Can you give them a reply after the meeting? He said that he was not able to come up with a percentage. I'm chairing the meeting and they will give you the percentage after the meeting. Next, Mr. Holden Chow. Thank you, Chairman. I would like to thank the deputations for coming to the hearing. I would like to talk about dental care professionals. Dental hygienists, dental therapists, they have given their views today. For Dental Council and their subsidiary committees, I hope that they will have dental care professionals as members of the council. And I think that they have conveyed their views very clear. And I have proposed such a suggestion previously. I would like to also talk about dental therapists or dental hygienists. Dental hygienists can play a larger role. For Canada, they have 30,000 dental hygienists, and they can scale their patients independent of a dentist. For senior dental hygienists, perhaps we can allow them to perform scaling service independently. As a result, we will have dentists take care of other cases. That's my view. Deputy Secretary, thank you. When we design the scope of work of the dental care professionals, we adopt a risk-based approach, and we want the dental care professionals to be able to carry out their duties. The members said that we should include dental care professionals as members of the committee and dental council. We will consider such idea.
Mr. Lam Chen Singh. Thank you, Chairperson. Thank you, Chairman. The Dental Association cited an example. Some non-locally trained dentists delegated some duties to nurses incorrectly. They were convicted of professional negligence or misconduct. If they need to take an exam, this is a headache to the administration. You need to set a new examination. So, what proposals do you have so that non-locally trained dentists will also have an online exam or an online course so that they will have a better understanding of their professional code of practice? I'd like to ask Dr. Lee from the Dental Council of Hong Kong. I didn't read dentistry. Many dental students said that they don't just work on Phantom's head. In total, they have 4 years of clinical experience, 20 hours per week treating patients. They also treat their patients by themselves. What is the difference between the existing clinical or practicum experience and the proposal? Is the difference as great as 9 months, half a year, or even it can be plugged, the gap could be plugged in a summer's time? Dr. Hui, thank you. On non-locally trained dentists, there are 2 pathways in which we can deepen their understanding of the local situation. After they have their licenses, they need to stay in a designated institution to undergo a period of assessment for 1 year. If they are on limited registration or special registration, they can only work in specified institutions, including the HA. They need to work for at least 5 years before the licensing examination requirement can be exempted. We think these arrangements are sufficient. Dr. Lee? Thank you, Chairman. On undergraduate training and internship, they are different in nature. The aims are also different. On basic undergraduate training, they are given basic training up to this safety standard. We have clinical activities as well as curriculum design. Can I continue? Yes, please go ahead. That is, they need to meet our requirements. On internship, it's urgent. We need to provide services. We want to provide services for patients in the public sector, including the aging population in Hong Kong. There are a lot preventive initiatives, nursing initiatives. We need to cater for these demands. We need to conduct skill matching. In the basic training of undergraduate programs, we don't have such training. There's a formula, contact times time, that will amount to experience. From undergraduate program, from simple to complicated, we want to enhance quality as well as efficiency. That's exactly why we have this plan. Next, Ms. Connie Lam. Thank you, Chairman. I thank students, dentists, and representatives to the public hearing today. in the meeting, I mentioned the internship period of dental students. I'd like to ask the Deputy Secretary, will you consider implementing the internship arrangements for the next cohort of students? Will you delay the start of the arrangements? That's not fair. Whether dentists or social workers, they also need to have informed consent. On this basis, will you consider putting back the arrangements? Dr. Chan, he used to work in the DOH. I recognize Dr. Chan. Regarding the specialist dentist, can we enhance the services provided by specialist dentists for SEN students, teenagers, or students with special education needs, or mentally handicapped, or the disabled? They are the target group of these specialism. So I look forward to more services in this regard. Do you want Dr. Chan to take this question? Yes, Dr. Chan, please. And Dr. Chan, when you're ready. Dr. Chan. Thank you, Chairman. We can definitely take in more internship dental graduates to provide services, to provide special dental care services. I believe this experience will be helpful to them. I will provide data as requested by Ms. Connie Lam. The role of the government is not to approve the dental program curriculum. The chairperson of the DCHK has already explained. Yes, I understand. Ms. Connie Lam asked about delaying the arrangements of internship. That is the 6+1. I believe Ms. Connie Lam was asking about delaying the arrangements. In my detailed introduction, we think that we need to put in place this arrangement as soon as possible. This is for the benefit of the public. Next, Professor Chan Weng-Kwong. Thank you, Chairman. I thank all those who have come to the public hearing today for their views. Thank you for showing concerns about the internship arrangements. I'm not against internship arrangements. This is important in terms of giving them more clinical experience, but I also understand that changing the curriculum arrangements will have an impact on dental students. Based on informed consent and the principle of fairness, will you consider allowing dental students to continue with the existing arrangements? Or like Ms. Chen Haoyan said, you can add more internship arrangements during their semester breaks in the summer holiday, for example. This can minimize the impact on their life planning. I'd like to ask Dr. Lee from the Dental Council of Hong Kong. If you find that there's insufficient clinical experience, why don't you discuss with the Hong Kong Dental Association as early as possible? Instead, we need to amend legislation to add one more year. Why is that so? Dr. Lee, thank you. Together with the Hong Kong U, we're working very closely and frequently with the Hong Kong U on the arrangements. We have an interactive process. There are quantifiable requirements. We also have very strict requirements. In our discussion, we feel that there is always room for improvement. Just like all examination processes, it's a continuous approach. It's a continuous process. Even for basic training and in undergraduate programs, we need to start from the basics. Once they have the first experience, then they need to further have practice. We are facing a huge public demand. That is how to conduct skill matching. We need to think from holistic view. Well, my question is, if you had earlier identified the insufficiency, why didn't you start the amendment earlier? Well, he has already given you an answer. If you do not accept it, we can't solve it. Well, Dr. Lee, in our examination processes, we comply with legal requirements, and it's been very strict. Ms. Lillian Kwok. Thank you, Chairman. Thank you all for attending the public hearing today. I have 3 questions. I hope the administration can provide me with supplementary replies. Members and students also mentioned there's a difference between expectations and the reality. Members proposed a transitional period. I'm not saying that we shouldn't add 1 more year, but can we give them 2 choices? They can choose. 1, for current students, they can choose 1 more year for internship arrangements. 2, they can also choose to undergo internship arrangements, training in their holidays, such as Easter, New Year's holiday, and so on. Some participants also mentioned for dental care professionals, DCP, we want to ensure a stable supply of DCP in the public sector before they can be made available in the private sector. We need to first finish the assessment. After the pandemic, dental services in the mainland are developing very fast. Many members of the public in Hong Kong also go north to have dental care services. Your projections up to 2035, there is still a lack of dentists. Have you factored in the fact that many members of the public in Hong Kong have already given up on local dental services? Instead, they go north to look for dental care services in the mainland. After the assessment, have you thought about probably there's a difference between the projection and the actual figures in 2035? If so, have you prepared any policies? Well, for the first question, member has already asked similar questions regarding assessment. We already asked the administration about assessment. Regarding DCPs, maybe the administration can take this question. Deputy Secretary, please. Thank you, Chairman. Regarding DCPs, we hope the arrangements can be put in place in 3 years. In 3 years' time, we have already enhanced training. We will keep a close watch on the situation and make adjustments if need be. Please rest assured. For the second round, while I can allow you to speak in the second round, this session will run until 10:30. I haven't yet spoken, but I won't be long. I just can't allow all 3 members to speak in the second round. Immediately afterwards, we'll have another meeting. Students need to understand, is it not fair to dental students how to strike a balance? When I read this bill, can we change the 6-year program from 6 years to 5 years of studies plus 1 year of practicum or internship? That's 5 plus 1. It may not be something that the administration can do. We also need to consider the views of professors at universities. That is 5 plus 1. We also need to see what professors think. In our deliberation of the bill, if you've listened to our meetings, in our discussion of the policies, we do want to see whether we can cater for your views. The administration's reply is that they think the internship arrangements should last 1 year, and it should be 6 plus 1, like the practice of doctors or medical students. As members who just now spoke, they also said the same. I don't need the administration to reply. Any other business? At 10:45, Ms. Elizabeth Quat in the first round. Chairman, as we still have time, I'd like to ask the Dental Council of Hong Kong, Dr. Lee. Dentistry programs in other countries aren't as long as 6 years, but right now it's 6 plus 1 in Hong Kong. It's proposed to be 6 plus 1. It sounds quite long. The cost is quite high. What is your evaluation of the number of applicants? Well, interns are paid. That shouldn't involve any increase in costs. Dr. Lee, thank you, Chairman. While I can't estimate the change in number of applications, but yes, different dentistry programs around the world have different requirements. Their structures are also different. In Hong Kong, for instance, when secondary school students graduate, they go straight into undergraduate training. For example, in Hong Kong U, the requirement is 6 years. It's not vocational training in Hong Kong U. It's made up of education and training. Of course, we attach more importance to training. So for education, for example, in the first 1 to 2 years, or should training be enhanced after 6 years, we can discuss with the university. But our assessment is about the eligibility for registration. We absolutely respect academic freedom or autonomy. There are also many views in the community as to condense a program. While I was studying for the dentistry program, it was only 4 years. Times have changed. There are more new contents. The training needs to be longer. Internship is different from undergraduate training in nature. Internship is about skills matching. That's a lack of services in the community, providing services to the old, for example. That's the closest to our hearts. Dr. Hui from the DOH already said that the programs cover all the contents as required to provide services in the community. So from what I heard, you don't think the Dental Council of Hong Kong should step in and have a say in the number of years of the program. Is that correct? The Dental Council focuses on the internship arrangements. Is that so? That's correct. Our function is limited to registration matters. In relation to education and training, like other stakeholders or members of the public, we will give our opinions. Chairman, like everyone else, we also want to see an enhanced standard of dental care services, but 6+1 is indeed too long. The Dental Council should discuss with different parties, well, not necessarily Dental Council. The administration and the Hong Kong U should consider whether 6+1 is necessary. Well, I think we won't be able to wait until their assessment is over to decide 6+1 or 5+1. At 10:45, we'll hold the 7th meeting. We'll continue with the scrutiny of the bill. I thank deputations and individuals for coming to the public hearing this morning. If you would like to provide your submissions, your written submissions, you can leave it on the table. They will be for the reference of our members. You can write down the name of your organization or your own name. If you have further views, you can submit written submissions after the meeting. There is no any other business. Meeting adjourned. Thank you.